Dr. Michelle Haynes.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like pregnancy, postpartum, perimenopause, premenstrual disorders, and infertility.
Today, we're going to be finishing up our menopause series. So if you haven't seen the first two videos about what's the definition of menopause and the symptoms that you can see during menopause, please pause here and go back and watch those. They're really short. That will help give you some context about what we're talking about today. So we're talking about treatment options.
Okay, so the most effective treatment option for vasomotor symptoms, or those genitourinary symptoms that we talked about in the last video, are hormone replacement therapy. And this is really safe in most people. There are some people where it can be higher risk, so it's definitely important to talk to your doctor about the risk. And in people who have had a history of breast cancer or who have had a history of coronary artery disease, like having a heart attack, those people tend to be at more higher risk, so they definitely need to be talking to their doctor.
There's different options, right? There's like oral hormone replacement therapy, there's vaginal estrogen, there's patches, there's plenty of options. So this is where your treatment can be really customized for what's right for you.
Yeah, definitely though, don't do pellets. We've seen some terrible things with pellets.
Yeah.
Don't do that. But all the other things are,
whatever your doctor recommends.
Right.
So other treatment options would be SSRIs, specifically paroxetine and escitalopram. So if you're going by brand names here in the United States, that would be Paxil or Lexapro.
And those have shown to have some evidence in treating those hot flashes that a lot of people get. Some other ones that can treat hot flashes are venlafaxine and desvenlafaxine, which is also called Effexor and Pristiq.
So specifically with the vasomotor symptoms like hot flashes and night sweats, we could use things like clonidine, which is an alpha blocker, or we could potentially use gabapentin for those type of symptoms.
And then a lot of women have trouble with sleep in perimenopause, like we talked about in our last video. So options for treatment for sleep are CBTI, also known as cognitive behavioral therapy for insomnia, yoga, and aerobic exercise. And what we mean by aerobic exercise is exercise where you're like getting your heart rate up and getting a good sweat in.
Mm-hmm. Some people will consider like supplements or vitamins, and I don't personally know of any data supporting the use of those for menopausal symptoms.
Yeah, there's not a lot of great supplements out there that have evidence behind them showing that they're helpful for perimenopause symptoms. And then I think it's important to add on that when people are having an exacerbation or worsening of their mental illness symptoms in the perimenopause, using the medication that treats that illness best is what is first line for treating it during perimenopause also.
Right, so you said specifically if they're having exacerbation, but if they're also having new symptoms, we would just want to go with whatever treatment is indicated for their disorder. And then maybe at that time their psychiatrist or your doctor will consider prioritizing medications that also have evidence for other symptoms like the SSRIs that we mentioned or the SNRIs that we mentioned, kind of this idea of kill two birds with one stone.
Yeah, because depression and anxiety, like we talked about, are really common in perimenopause, but it might just be symptoms of depression or symptoms of anxiety. But some people can get actual mental illness episodes that come up in perimenopause too.
So there's plenty of options for treatment to help through a really difficult time. And I think just people don't talk about what it's like, what it is, what can be done. And that's why I'm making this video. So if you know someone that's kind of around this age, just give them the information so that they know what to watch out for. Save this for later for yourself if you need it. Please like, comment, subscribe. We'll see you soon.
Bye.